South Africa may have the fifth highest number of cumulative COVID-19 cases in the world, but the same can't be said for the rest of our continent. Africa as a whole is just more than 1 million of the 20 million cases diagnosed around the world. More than three-quarters of those diagnosed with the virus have recovered. There have been just under 24,000 people who have lost their lives across Africa. Although the number of COVID-19 infections is comparatively low, the African Centre for Disease Control has been proactive in trying to secure late-stage vaccine trials and finished products. Dr. John Nkengasong is the director of the centre. It's based in Addis Ababa in Ethiopia. He's got the latest on Africa's efforts to tackle the pandemic. Dr. Nkengasong, good evening to you. Thank you very much indeed for your time. I can't imagine how busy you are. Firstly, what kind of vaccine trials are you involved in across our continent at the moment?
No, thank you for the opportunity again to contribute to your program. As a continent, we want to be sure that we are prepared for both vaccine development and access. And we all recognize that this pandemic will only be stopped once we have an effective vaccine. So I think we have to prepare the continent at three levels. I mean, at level one is to make sure that as a continent, we coordinate our efforts to contribute to clinical trials for vaccines, both at phase 1, which is dealing with safety, and up to phase 3, which deals with effectiveness of the vaccine. As you are aware, only South Africa currently is conducting vaccine trials for COVID. So we want to improve that scenario. I think that is one. The second thing we are dealing with is to develop a financing and procurement mechanism for the continent. Should there be an effective vaccine, what should we do as a continent to access these vaccines and procure them? You've heard in the media that countries are negotiating already with companies that are producing vaccines to have access to them. And there's the COVAX facility in Geneva. So what do we do as a continent to be sure that we are not left behind? And then thirdly is the community. We have to be sure that the community is well prepared and that a community understands what COVID vaccines are and that they also dispel the misinformation that characterizes COVID vaccines. So those are three different areas that the Africa Centers for Disease Control and Prevention are working on.
Okay, I mean, one of the big areas that countries often need help with is epidemic modeling. In other words, trying to predict what's going to happen. Are you helping countries in our continent model the epidemic as well?
We are working with countries in a very comprehensive way in respect to adapting the strategy as the pandemic progresses. If you recall, very early on, our main focus was to prepare the countries to respond in terms of staffing them up with diagnostics and personal protective equipment. And we launched the initiative at that time called the Partnership to Accelerate COVID Testing, where we recognized very early on in May that the number of tests for the continent was very limited. When we launched that, we set ourselves a target of 10 million to conduct 10 million tests in the next couple of 3 months. I'm pleased to announce that as a continent, we have now tested over 9 million or conducted over 9 million COVID testing, thanks to that accelerated initiative. So I think we keep adapting our strategy and advising countries as the pandemic progresses. At this critical junction that countries are easing the lockdown on the economy, we will next week be launching a campaign called Africa Against COVID-19, which is underpinned by the need to protect the borders, protect the travels, protect the economies and livelihoods, and protect schools as schools prepare to reopen. So I think that's what we are doing to adjust our strategy as we see the pandemic evolving.
I mean, there's all sorts of conversations around vaccines. One of the great risks, of course, is that the countries with resources, if a vaccine arrives, if someone does develop a vaccine, it's going to be the rich countries that get it first, when actually we might find through the path of the pandemic, it's us in Africa who need it more.
No, absolutely. That's what we've made it very clear under different platforms and fora to say that a vaccine should be considered as a common good. And we are always reminded of what happened in 1996 when treatment for antiretroviral treatment for HIV and AIDS was available, but it took 7 years before that treatment was accessible to the continent, and many Africans died because of that delay. So we want to be sure that we learn from that experience and we are at the table. We are also reminded always of the 2009 pandemic of the H1N1, another influenza virus that vaccines were already purchased in advance. And if the pandemic had spread to the continent of Africa, we would have been left without vaccines. So I think that is why we are taking this vaccine dialogue and effort very seriously as the Africa Centers for Disease Control and Prevention and as an arm of the African Union. As a matter of fact, we will be discussing this at the highest level of the continent next Thursday at the Bureau of Head of States meeting so that we get their full endorsement to move this vaccine strategy forward.
I mean, there must be huge concern. There's concern for us here in South Africa about the situation in Zimbabwe, just across our border, a very difficult space. The economy, I think we can say, I'm afraid, has fallen apart. There are political problems. What are you able to do to help people in Zimbabwe?
As we speak, we are currently supporting people in Zimbabwe with a lot of testing and contact tracing. I mean, as you are aware, we don't have a vaccine, neither do we have a treatment. So what we have in our hands now are what we call public health measures, and we are supporting them with responders and community workers so that they can be able to test, isolate those who are infected, and then go after their contacts using a community approach. What we are recommending to countries is really to use the whole of society approach. The community needs to own this response and show leadership in this response, including in Zimbabwe, including in South Africa and other countries. That is the only way we are going to fight this pandemic, by making sure that we arm the community with the knowledge, the information, and the tools that are required to fight this pandemic.